Hi, my name is Norma Johnson. I am a licensed pharmacist as well as a licensed independent insurance agent. And I'm also the founder of a company called Strategies for RX Savings. And what that is an online platform that is geared towards insurance agents that allow me to train them in all things about Medicare Part D. Just to give you a little bit of background about me, I have been in the pharmaceutical industry for almost 25 years. I spent 22 years in a large retail pharmacy. And I've been doing it a long time. And in my 22 years of being in a pharmacy, I had a passion that I've had for all these years of being of wanting to help people save money on prescription medications. I was in the pharmacy before Medicare Part D. So of course, anybody that was Medicare recipients prior to 2006 didn't have prescription drug coverage. So of course, they were on their own. And if they couldn't afford their medication, oftentimes they didn't get their medication, unfortunately, which is not good for them managing their health and their disease states. So after 22 years with this retail pharmacy, I decided that I was no longer happy in retail because I no longer had the time. If any of you have gone into a retail pharmacy anytime recently, you know that the staffing is not adequate. But that's a different discussion, probably for a different day. But I didn't have time to help people find savings on their prescription drugs that maybe wasn't covered by their plan, or the plan had a very high copay, and there was a better way to get the medication. And so I ended up heading down the independent insurance agent route, which has led me to developing a platform where I have been fortunate enough to be able to train a lot of insurance agents across the country and really sharing my expertise in Medicare Part D, because that is what I have done. So this is actually the second video I've made in less than 24 hours. If you haven't seen my video that I made on Medicare Part D, past, present, and future, please find that on my YouTube channel, which is www.youtube.com/the @ and then strategies, the number 4, RX Savings. That will lead you to my page where you can view that video. I think it's important for everybody to understand where Part D came from, the foundational principles it was built upon, the effects that the Inflation Reduction Act is having on our plans, and our Medicare recipients are beginning to receive their annual notice of change, which is going to be helpful for some, but it's going to be upsetting for a lot of people. There's definitely a lot of changes that are coming our way, and it's very important that we educate, and I am all about educating. Being a pharmacist, I want to educate all Medicare recipients across the country on Medicare Part D, as well as some of these programs, one that we're going to talk about today, that hopefully you will find helpful, so that you know how to go into 2025 with your agent, so that you are better prepared. So I love doing videos on behalf of good agents that want to share my expertise. Some of them are members, and I would hope they all are, but in the event that somebody's not, I still want to reach all consumers. So it is important to me. So if you get this video, from your agent or from a friend, please pass it on so that we can educate everybody that's a Medicare recipient across the country. What we're going to talk about today is a Medicare Prescription Payment Plan program. It's also being called the M3P. It is a brand new program that starts January 1st, 2025, and it was part of one of the changes of the Inflation Reduction Act. And this is really what Medicare recipients need to know about this program. So this program is available for all Medicare recipients, regardless where you're at or what medications you're on, but it will be more beneficial for some than others. So we're going to cover that. So it's beginning, like I said, January 1st of 2025. All plans are going to be required to offer it. And it's an opt-in program. You will never be automatically opt-in by anybody. You will have to make that choice and opt in yourself. But for any Medicare recipient that has either a standalone prescription drug plan, those are the ones that pair with either Original Medicare or Original Medicare plus a Medicare supplement, or a Medicare Advantage plan that includes a prescription drug plan, and we call those MAPDs. You can opt in if it's beneficial for you. So the whole premise on this is because we know in January, when people have drug deductibles, the first thing you do is you go pick up a prescription and you're going to be hit by the deductible. And if you're on an expensive medication, you may get hit with that full deductible. And that deductible, which is set by Medicare every year, is going to be $590. Now, that won't be on all plans, but for those people that is on their plan, it could be a financial burden. So Medicare has set up this program so that somebody can opt in, and certain things are going to happen. So it's going to take some of the financial pressure off those people that may not be able to pay that deductible and those high costs up front. So we're going to get more into that to give you the gist of what the program is actually about. But who is it primarily going to benefit? Like I said, are those with deductibles. So a deductible on your drug plan, as well as those on expensive meds. Now, if you have high deductibles or high cost, or you know you're going to hit the $2,000 max out of pocket, which also starts January 1st, 2025, then you may want to consider strongly to opt into this program. And what that's going to do is it's going to allow you to pay $0 at the pharmacy, but then the plan will bill you, and they will spread that amount over the course of the year. Now, the math will get a little bit tricky, and we're not going to get in per se into the math today, but we'll get into enough to where you're going to know to ask your agent some questions or ask your plan some questions when you call to opt in. So there's that. So you want to evaluate your personal benefit. So if you should opt in or not. Now, if you are on low-cost generics and you're not on any brand name meds, even if you have a deductible, it's probably not going to benefit you. Is it going to hurt you? No, but it's probably just going to be more of a pain because you would pay $0 at the pharmacy, and now you've got to get a bill from the plan, and you've got to remember to pay the bill. So if you can afford your copays, afford paying towards the deductible up front, then it may not be a good fit. So you want to look at your situation. And like I said, if you can't afford the full $590 deductible, if that's the plan that you're on, and you take a medication, maybe a medication that would normally cost $1,000 in the month of January, well, you're going to get hit with that full deductible plus your copay. So it may benefit you to enroll into this plan, because that way you're picking up the medication, you're going to get billed, they're going to spread it out based on the criteria that Medicare has set up for part of the year, right? Or all of the year, depending on on your situation. So it would definitely benefit you there. So make sure that you discuss this with your agent and determine if it is a fit for you. So, like I said, it is an opt-in program. You can opt in starting as early as October 15th, but if you have to wait, since it's a brand new program, you do have to wait until your plan is actually put through the process. So let me explain that. So October 15th of this year, of course, as we know, annual enrollment period will open up and your agent can actually put you on a plan or change plans, you know, or you can enroll into your plan of choice at that time. It does take a little bit of time before they actually get that plan change approved by Medicare and then get you your information. What I would do this year, since this is a brand new program, is even if you enroll into a plan with your agent October 15th, wait until you get your welcome kit. And then when you get your welcome kit, I'm sure, because they're going to be required to tell you about this program, then go ahead and call them and opt in or follow their other directions. They're going to have a few different ways that you're going to be able to opt in. What we know you're not going to be able to do, at least this year, is opt in on your actual enrollment form. So the agent won't be able to help you do that this year, perhaps in the future, but not this year. And you're not able to enroll in your retail pharmacy either, or your pharmacy of choice. So you're going to have to deal with your plan to do the enrollment. But you will be able to enroll before January 1st, but you have to at least give them a little bit of time to get it in the system and get you your welcome kit. So when you get it, that's when you call them and you can opt in. And I think I've covered pretty much everything on this slide. So enrollment in this monthly payment option, it's voluntary. So it's up to you. And we'll cover that a little bit shortly, but you will be able to opt out at any time, but there will be some stuff you need to know about that. You must opt in, and you may opt in as early as the annual enrollment period or anytime during the plan year. But because this is a brand new program, we need to wait till you get your welcome kit. Or if you're going to continue your plan into next year, you will receive information from your plan about the program, and then they will guide you. So the enrollment can be completed by various means, and this is going to vary by plan. So perhaps paper forms, but I don't think we're going to see that this year. Most likely it's going to be by calling your plan or doing it on their website. So watch for your letters from your carrier and follow whatever they show you and tell you is the guide to being able to opt in if that is what you're choosing. So upon enrolling, recipients will receive notification that their Part D plan accepted their enrollment into this program. And of course, like I said, you have to opt in, they have to accept it, but that way you know, okay, yes, they've processed it. So you will receive monthly billing statements detailing your out-of-pocket expense and the costs that are due. We'll go over a little bit more of that in examples. So just to recap, you have to opt in. So when you opt in, you will go to the pharmacy, you're filling a prescription. Doesn't matter, as long as it's on formulary and it runs through your plan, it's going to go through this program if you've opted in already to the program. At the pharmacy, on the pharmacy label, it's going to say zero copay, because you're going to be paying zero up front. You're going to get a bill from your plan. Now, it depends on some math to know how much are you going to pay. Medicare has set up the guidelines for these plans. Your agent can cover some of this with you, but it's all going to start in January with taking that $2,000 max out of pocket that starts and dividing it by 12, because there's 12 months in the year. So you cannot pay more than $2,000 as long as it's on formulary and you're using your plan for your medications for the month of 2025. So that's really what they're guiding it by is $2,000 divided by 12. That will be $167. And if you go to the pharmacy and you pick up something that your cost would have been more than that, then you're going to get a bill for the $167, right? You're not going to be paying the full price up front. You'll get the $167, and then they're going to spread it out. So February's payment is going to vary depending on what else you picked up. If you didn't pick up anything else, then they're going to calculate the max monthly payment depending on how many months are left in the year, and they will figure out what is that amount versus how much you owe, and you will pay the lesser of the amount, and it'll keep continuing. The math will be the same all the way down until you owe nothing more for the prescription that you picked up. So it's going to be a lot of math, but if it helps you, that's all that matters. It doesn't have to be any more complicated than what it needs to be. You don't need to understand, as long as you remember, I didn't pay that at the pharmacy. I'm going to get a bill from my plan. So be on the look in the mail, because you don't want to miss your bills, because then you could get in trouble. So you don't want to do that. So you will pay $0 at the pharmacy at time of pickup. So instead, you will pay monthly payments directed by your Part D plan, and they will adjust over the course of the year. Now, if you are one that you like consistency, you have a budget, and you want to keep that payment flat, then you may not want to opt in. You may want to figure out how you can have that upfront cost by some other means of whether you have it and you just pay for it. Perhaps you put it on a credit card. The only thing that I would say is, if it's a choice between opting into the plan or putting it on a credit card, opting into this plan doesn't cost you anything. There is no interest. So you may not want to put it on a credit card unless you're going to pay that credit card amount off before you have to pay interest. So don't be afraid of opting into this program if it will benefit you, because there are no fees. There's no late fees. Those things are all forbidden by Medicare. So the plan would be beneficial. But now, if you do like that steady payment of knowing you are going to pick up a medication, your copay is $45 after you've paid that deductible, you want to just keep paying that $45, then it might be better not to opt in and figure out some other way to pay that deductible up front. So there will be terms and conditions based on what Medicare says. So no additional costs, there's no interest, there's no fees, there's no late penalties in this program. So don't be afraid of the program. You just want to use it in the event that it's going to benefit you. But if it's not going to benefit you, then by no means are you obligated to opt in. And you can opt in at any time during the year. So in January, February, March, you're on low-cost generics. You don't need the plan. But maybe in April, you start an expensive tier 3 medication, and now you're going to pay that deductible because it wasn't applicable for your plan on tier 1 and 2. Well, then it may be beneficial to opt in. And when you opt in, so say, for example, you go to the pharmacy, you find out, okay, I'm being prescribed a brand name medication. Now I'm going to have to pay the deductible. And you go to the pharmacy and they say, hey, Mrs. Patient, it's going to be $700, and you don't have the $700. Then you can say, you know what? Keep the prescription, just keep it in the bin. I'm going to go call my plan and I'll come back and pick it up tomorrow. So the pharmacy will just put it back in their waiting bin. It'll be filled waiting for you. But you go home, excuse me, you contact your plan, you opt into the program. Now the program has 24 hours to get that plan activated once it's after January. Now, before January, which you wouldn't be using it anyways, before January, if you opt in during annual enrollment period or before January 1st, they have to get it activated within 10 days. But once January 1st gets here, and you opt in sometime during the year, you have to give them 24 hours. So in 24 hours after you've opted in, you will go back to the pharmacy. You will say, I've opted into the payment program, so I need you to reprocess the prescription through my insurance. Because remember, you just had the pharmacy say, just hold it in the waiting bin. They won't know to redo it until you tell them. Because I don't believe, and I have not read, that they're going to be notified in any way. You just know that once you've opted in, you will be paying $0 at the pharmacy for anything that goes through your plan. That label still says $700. So they will reprocess it through their system. It'll run through the program. They'll put a new label on it. They'll scan it through the register, and you will walk out without paying anything at the pharmacy. That's how that's going to work. And then you're going to watch the mail, because you will get a bill from the plan. Now, it'll be something, like I said, it depends on the month, because they will be calculating what you've gotten so far. So some of the things might be subtracted from that $2,000 max out of pocket, right? If you picked up some low-cost generics in January and February, well, that gets counted towards that $2,000. So now you owe less than the $2,000 for the max out of pocket. So it's going to adjust that amount that you'll be paying, but you will pay the lesser of the amounts depending on either the max out of pocket that they calculate it to be or what you owe. So it's going to be the lesser of the amount. So participants should continue to monitor their drug use and expenses throughout the year. This will help you understand your spending patterns and ensure that your program continues to meet your needs. Now, one thing as a pharmacist that I want to point out is, and this is just from me being a pharmacist, so your agent's not going to actually understand much of what I'm saying, but what I'm a little concerned about is that when you go to the pharmacy has already processed it. You are opted in, so now it's $0 on that label. You don't know how much that medication that you're picking up actually is. And I don't see where the pharmacy is going to know unless they process it again without it being on that program. But once you've opted in, so if you need to know how much that medication is going to be before you pick it up, you need to call your plan and ask, because they're the only ones that's going to be able to tell you. If you go in and you say, well, just take it off my plan, well, that just gives you the cash price. That's not what your plan would be charging you. So the pharmacy is not going to be able to know unless perhaps somebody has thought about that, and perhaps they're put it on, somewhere on the pharmacy. So if it's important for you, talk to your pharmacy. Maybe it's going to be somewhere on the label that the price would have been, but you've opted into the program, so therefore it's $0 at the pharmacy. But you may want to know how much that is, because I know you're not going to want to feel like, well, dang, I shouldn't have picked that up because I really can't afford that even long term. So that might be something that you want to consider if you've opted in, is make a quick phone call or sign up online so that you can see what prescriptions are run through your plan, because it should show you what the cost of the medication to you is actually going to be. And as a pharmacist, I feel like that is something important that you're going to want to know before you pick it up. Even though you're going to pick it up for $0 at the pharmacy, you're still going to owe that money. So communicate with your plan. You can communicate on the phone. You can communicate just by having your account set up. And if you're tech savvy, that's what I would do, is set up your account, get them to help you. Maybe your agent has some experience with their site, and get used to looking at how much it is before you go pick it up. So utilize educational resources, CMS, of course, which is Medicare, and the Part D sponsors, which of course are the health plans. They are going to provide educational material. CMS is going to come out with educational material. When you get into looking at some of the math, don't get overwhelmed at looking at examples. It gets confusing. It doesn't need to be. You're never going to pay more than what your prescriptions would have been anyways. You're never going to pay more than the $2,000. It's just a program to help you spread out the cost. The biggest thing is you're going to want to make sure you watch your mail so that you can pay your bills on time, so that you stay in the plan. So definitely take advantage of all your resources. Talk to your agent. I would hope that they would know a little bit more about the program. I have trained a lot of them. And the next thing, that was my presentation, but I want to go over one more thing. And it's just kind of a cheat sheet that I made. And I'll go slow. So if you want to take pictures of it, you most certainly can do that. So eligibility, let's recap. All Medicare beneficiaries with a standalone PDP, otherwise known as a prescription drug plan, or an MAPD, a Medicare Advantage prescription drug plan, are eligible for this program. Who will benefit? Well, those with high cost of drugs, so high copays, or those with deductibles, and if they don't have the means to pay that up front. Does it hurt anybody if they enroll and you end up not having any high cost drugs? No, it doesn't. It doesn't. It just may become a pain to have to get a bill and then write a check or call them or get online, however you're going to have to pay that bill. So that might be a pain. So if you're not on high cost meds, it may not be a good fit, but totally up to you. When can somebody opt in? And we talked about that. So you can opt in prior to the plan year, so during annual enrollment period, but wait for your welcome letter, or anytime during the year, right? So after your plan starts, so after January 1st. How can someone opt in? Your plan is going to tell you that. They're going to have several means. So whether it be maybe a paper form that they mail you to educate you about the availability of this program, and you can fill it out and mail it to them. Electronically, perhaps on their website, you can go into your account and opt in, or you can call them on the phone. They will be calculating a maximum monthly cap. It's a monthly payment cap. That math is all set by Medicare. So everything is going to be going by that. So you're going to pay the lesser. So if your cost of your medications was less than that cap for that month, you will get a bill for the cost that you would have been paying at the pharmacy. So the cost of your meds. If it's a cost that was more than that max, then you're going to get charged that max. And then they'll keep doing the math until you have that paid for. So don't get overwhelmed with the math, okay? It's just math. So what happens if someone doesn't pay their bill? This is important because you need to know that you need to pay your bill. So there will be a 60-day grace period. So they do give you a little bit of time. Now keep in mind, there is no fees, no interest, no late charges, but you do need to pay for your medications. I feel a little bit sorry for these plans because of the changes in the Inflation Reduction Act. They are definitely getting squeezed, and we don't need to make the situation worse by not paying the bills, because at the end of the day, it would hurt everybody that's on Medicare. So definitely watch the mail, pay your bills, pay it according to how they're saying to pay it. If you have questions, call your plan. They will be able to help you. Can the plan remove you for non-payment. They cannot remove you from your drug plan or your Medicare Advantage prescription drug plan. They cannot, it is forbidden. But can they remove you from the Medicare prescription payment plan program? Yes, they can. So if you do not pay, and it's after the 60 days and they keep sending you bills and you're just not paying, or not paying attention and not realizing you're throwing away a bill, because you got to remember to pay those, then they will boot you out of the program. That does not mean you don't owe them the money. You will still owe them the money. You can't get out of that, okay? What happens if you move from one plan to another? So say, for example, you were in an Aetna plan and you opted in and you owe Aetna some money for some prescriptions, but then you moved and you came out of the Aetna plan and you went to Humana. Well, you still owe Aetna whatever you owe them. Now, they will communicate via the mail. You will want to let them know, hey, I'm moving plans. I still owe you money. They're going to be able to let you continue your payments how it would have been until you have paid off that debt that you owe them, or you can choose to pay them all that you owe. And then you will opt in again. Just because you've opted in with one plan does not opt you in if you make a choice, a plan choice. A change, let's see if I can say that. So a plan change during the year. So if you've opted in at the beginning of the year and you were on Aetna and now you're moving to Humana, you must opt into that plan for Humana. It will not automatically be done for you, but you can be in a position to where you're going to owe Aetna from the past and you will owe Humana for the future. So keep that in mind. And I just covered that. So can you opt out of the plan? You can always opt out of the plan. Just keep in mind that if you opt out, you're going to get a bill that is either for the full balance of what you owe your plan, or they'll let you continue making your monthly payments as they will automatically be until you have paid your debt. And that's honestly the Medicare prescription payment plan. It's there to help you in the event that you have high drug costs. Utilize it if you need it. If you don't need it, don't opt in, right? If you have questions, talk to your plan. You can always talk to your agent. They're limited on what they can do. They can tell you about the program, but they can't opt you in. The pharmacy can't opt you in. The pharmacy may or may not have a lot of knowledge about this program. We do have to educate them, but you got to give them a little bit of grace. They're not actually involved. So they might not know a lot about the program, but that is it. So I wanted to just do this so that you can understand going into 2025 what options you have. So I appreciate your time. Make sure that you talk to your agent about this. If you don't have an agent, talk to your plan or get an agent. An agent is definitely a valuable asset. An agent doesn't cost you a dime. They are there to help you, guide you through, and be your advocate. So they definitely have a vested interest of helping you take care of things. So I appreciate you. Y'all have a great 2025 and watch for more videos. I will be covering next. There's a change in the way that we calculate your true out-of-pocket expense. And what that is, it's the progression of you getting into catastrophic. So you hitting that max out-of-pocket of $2,000. Things are calculated differently for 2025. So I want to explain that so that you know how to look at plans with your agent. So your agent, of course, is studying and learning how to deal with this themselves. And then they'll be able to help lead and guide you on figuring out what plans what might be the best for you to consider as options. So keep an eye out for the next video. I appreciate y'all. Take care of yourselves. Bye.